Hello. Hello, MISLAV.
Hi.
Hi. I'm just letting people in and I will make a short intro. Hello.
কত লোকরাই আছে মা ভূতের বাচ্চা বলতে অনেকেই আছে কিন্তু মা সবাই ভূতের বাচ্চা না সময় একটা ভূতের বাচ্চা সবার জন্য না হ্যালো
Hello, let's just wait a little bit for everybody, like maybe wait 1 minute more, and then I will start with a small intro, and then I will let MISLAV to give this lecture. Okay, there are some more people waiting. Okay, I would just like to kindly ask you to switch off your microphones while the presentation is going on. And then when you want to ask the questions, please feel free to turn on the both camera and your microphone, or just microphone, whatever you feel like. Okay, if somebody joins later, I will let them in, of course, but we can start. As I said, I'm going to make just a small intro, and then I will let MISLAV to give the lecture of paleoradiology and its application in bioarchaeology and archaeology. So this is, first of all, welcome. And my name is Natasha Sharkic. I'm PhD in physical anthropology, and I'm founder of AITA Bioarchaeology. So this is the first class of the online course, advanced course in bioarchaeology. And in this next 2 weeks that we're going to have 12 classes, each one approximately 2 hours lasting. And we're going to cover a lot of interesting topics together, of course, with some of experts in their fields, or people who are really into that topic. So there's maybe we're going to change a little bit the schedule from the one that was stated the first place in the site, because of course when we are making the schedule for the site, it has to be several months before we can actually know like what will be our real schedule. But don't worry, all the classes will be we'll held all the classes, but just maybe a little bit different order. So today's class, as I said, is going to be about paleoradiology, and you will see how it's really amazing tool for both archaeology, bioarchaeology, fossils, forensic, and so on. So if you're interested, yeah, you will see that there is also like paleoradiology workshop that is just like very intensive, hands-on on the course that you can follow in you can apply. It will be the first couple of days of December, like from 1st to 4th in Croatia, in Zagreb. And if you're of course interested in those topics of advanced course in bioarchaeology, you can still apply, because this apart from this free class, from tomorrow it's starting the rest of the program. So for next 2 weeks, we are going to talk about advanced osteotaphonomy, funeral practices, and type of burials. We have one class entirely dedicated to cremation because it's always a problematic field for most of archaeologists and bioarchaeologists, both in a term like how to excavate it and in a term how to analyze it. There will be classes about osteometry, estimation of ancestry, sex, and age. I know this is a basic, but many times we have a situation that actually people really need to refresh their memory. So that's why we also think, we believe that it's important to go again through that, and at least you can have the idea of like the newest methods, like new literature, and getting the more information on that topic. There will be also introduction or archaeology that will, this class will give Dimitri Markovic, who is PhD candidate in archaeology. The next will be like the introduction to archaeobotany. This will be given by Anna Smuk, who is PhD candidate as logical archaeobotany. There will be one entire class dedicated just to study and analysis of non-adult skeletal remains, because then this is also the weak point for many people who are just start to work with the bones, because as you know, children bones are quite different from adult ones, and of course there is this lot of different phases in growing. And this one will be given by Sofia Zdral, who is PhD candidate in development genetics. Then we will also have dental anthropology class. This one will be given by Laura Gonzalez Garrido. She is PhD candidate in dental anthropology and soon to become a doctor. And we will also give the class of, there will be the activity markers and occupation stress, molecular osteology, and most frequent pathologies. Sorry, it got stuck. Okay, yeah. Sorry, now it switched too much. So today, today's class is going to be about, as I said, application of paleoradiology and bioarchaeology, and we will go through history of it a little bit, and also we'll see how it can be applied in many different contexts. So it's both, it's useful both for work with mummified remains, with estimation of paleopathology. For this is like extremely important, because many diagnoses are completely impossible without X-rays or CT scan. Forensic cases as well, and archaeological artifacts. So like this is really incredible tool for all of us who are working with some ancient remains, human or non-human, even animals, of course. And just to introduce our lecturer of today, it's Dr. MISLAV ČAVKA, who is working at a radiology university hospital centers in Zagreb, and he's also teaching in University of Zagreb School of Medicine. And he's one of the most active paleoradiologists. He has a lot of works and books and publications behind him. And as we also mentioned, he is founder of co-founder of Paleoradiology Workshop and organizer of International Scientific Multidisciplinary Conference, Archaeology Meets Paleoradiology. So I hope that you will enjoy. I hope that you will find this lecture interesting. And now I will let our lecturer today, MISLAV, to continue.
Thank you, Natasha, for this introduction. I see that we have over 50 participants. It puts me under pressure. I will try to give you the overview of paleoradiology with 5 cases that maybe can illustrate what paleoradiology can provide to you as anthropologists, what we can offer you as an additional tool or this will stop others. Okay, continue. Huh? I can share now the screen.
Yes.
So what I intended to show you is the application of paleoradiology through the cases. I hope that it will be not revealing too much, although these are the most interesting cases that I had. So in any point of a lecture, you can ask questions or just put your questions into the chat. I think it will last around 25, 30 minutes, and please feel free to interact. So as Natasha said, I'm MISLAV ČAVKA. I work at University Hospital Center in Zagreb. So to give you an overview of paleoradiology history, I'm sure you have all heard something about it. So discovery of X-rays was made in 1895 by Konrad Röntgen in Germany, and only 3 months afterwards in Germany it was used in scanning the mummies in the Museum of Frankfurt with this child mummy. And these are the original images of X-ray of the knees. And 120 years later, it was rescanned, and these are the images published 120 years later on the same mummy. So you can see from where paleoradiology has evolved to where we have reached the state of the art, the moment state of the art in radiology and in paleoradiology. Croatia was put on the map of paleoradiology just at the beginning of the 20th century when Gorjanović Kramberger, who was the discoverer of Neanderthal men in Krapina, which is a small town near Zagreb, and he scanned on X-rays, he scanned fossil remains of Neanderthal men in hospital in Zagreb in 1901. Afterwards, with the development of radiology, paleoradiology is developed as well, and first CT of mummified brain, and the whole mummy was scanned in Canada. And afterwards, people tried to use MRI as it was done in radiology. So they tried to do it in paleoradiology as well. But as there is a lack of protons in dehydrated body, it was not possible to do it without rehydration. Not until 2007, when Professor Riley from Zurich has employed the MRI ultra short echo time sequence, where he could get signal from unbound protons. And here you can see the image of the head, of a mummified head. So I will start with my first case in paleoradiology, which was Egyptian mummy from unknown period. It was even thought it was fake mummy, as it was located in a fake sarcophagus in Zagreb Archaeological Museum for 150 years. And you can see with this image of the head, sorry, just a second. I think I switched. Can you hear me now?
Yeah, we can hear you, but you turn off the screen.
Okay, because it said that AirPods Pro was turned on. Okay, sorry. So it was a mummy that was classified as unknown mummy from the Zagreb Museum, or the fifth mummy. So you can here see the CT of this mummy with abundant line and elements around it and wrapped around, and you can right away see this unusual artifact which was not seen from the outside, and this hole in the back as well was impossible to be seen with naked eye. We can observe this interesting metal artifact, which is almost a meter long, and it serves as a reinforcement of the stature of the mummy. Even on X-ray, we can see that something is inside the head, and this is the VRT volume rendering technique reconstruction of this metal bar and metal bands. So this is the reconstruction, and this is virtually cut off the lateral part of the skull, where we can see the reconstruction of this object, for which we have thought it could be brain remnant or papyrus or some wooden stick. So we have decided to enter inside the head with endoscope under the CT guidance, which was the first time to use it simultaneously in paleopathology, which gave us the combination of two views: classical endoscopic view, so we can here see the ethmoid bone removed even 2000 years ago, and combination of CT guidance, which is useful for minimalization of the surrounding damage. So we took out the this wooden stick, and with the analysis from Faculty of Forestry, we got the results. It is a stick palme family. So it could have been a bamboo stick, which is interesting because in series of experiments during the 90s, German scientists have proven that it's easy to excerebrate a patient, the deceased man, just with breaking ethmoid bone with a bamboo stick and turning with turning motions to turn out the brain into the liquid mass, with it just can be washed out of the head. So we have recovered the object that probably ancient embalmers have lost it inside the skulls by accident. Beside of that, we have proved that it's a legit, let's say in that way, mummy from Egyptian period of time. We, as presumed, it firstly based on CT scans, but afterwards we got the confirmation with C14 as well, and we have seen this unusual artifact in form of metal bar and reinforcements, and this was probably done in the 19th century during the remummification, or let's say some sort of renovation, or before someone sold it to Archbishop of Zagreb, who then donated it to archaeological museum. Okay, the second case is similar. It is Lady of the House, or Careset. This was the inscription of sarcophagus, again one of the 5 mummies that we have in Zagreb, and we could easily see from first images that it is not the Lady of the House, not only on pelvic shape, but we can see phallus, remnants of phallus in soft tissues. Again, we can see on arches and mandible that it is probably a younger male. what everyone can see right away is this lithic lesion of the skull. We will talk about it a little bit afterwards. We can see this location at the level of C5, C6 with some bone fragments, but this is probably caused to, this damage was caused to the mummy by embalmers post-mortem. On the CT scan and the MRI, we will talk a little bit of about MRI afterwards. We can see that this is really a nice example of mummification, which based on which we presumed it could have been 21st, 22nd dynasty. We can see these organs that were wrapped again and put back inside the abdominal and thoracic cavity. We can see abdominal flank. This is something that Herodotus has testified when he wrote about the mummification. And we can now focus on these lithic lesions. Okay, so we can see one big lithic lesion on the skull, and we can see other smaller lithic lesions here on the occipital bone. Then we can see the destruction of Sella turcica, Turkish saddle, which is which is the saddle for hypophysis. We can see the destruction of orbital wall if we compare left to the right one, left to the right one, and we can see lithic lesions throughout the spine. So could have been trauma, maybe. Could have been neoplasm or tumor, yes, certainly. Could have been infection, it could have been. Trauma, we can rule it out because there are too small, these lithic lesions throughout the skeleton to be inflicted by trauma. So the main question was it a tumor or infection? We have scanned this mummy, which is the first time in paleopathology that the whole Egyptian mummy was scanned on MRI with this UT sequence, and we have received a nice signal from intervertebral discs, which was a signal, which was a case that it was not the case of infection, because if in infection, intervertebral disc, they get destroyed. So this was one case of a tumor. So let's see which tumor could have been. If we focus on all the cases that we had, so we had diabetes insipidus, so this is the destruction of Turkish saddle. We have exophthalmos, so we have the destruction of orbital wall. We have skull lithic lesions. We have, of which this is the most biggest one, the biggest one, and we have osseous lesion throughout the spine. So everything fits in Hans-Schüller-Christian's disease, which is a subtype of Langerhans cell histiocytosis, which is divided in these three entities. But again, it could have been a case with our mummy because it is a male, and it is between 20 and 30 years old when the second peak of this disease is found. And this was not the first time in history that it was described in Egyptian mummies. This is a real patient from my clinic experience. This is an example of biopsy. So the next thing may be some other investigation. We could take a biopsy and try to get from ancient DNA this mutation chromosome 7 and see if it is Hans-Schüller-Christian's disease. Case number 3, it's a femur with a tip of the arrow. which was found in intertrochanteric area. We can see first CT that we have made. We can do 3D reconstructions. We have seen some reconstructions before. This is volume rendering technique, and we can enlarge some elements from which were scanned. For example, this is this tip of this, this arrow of this spear. And if we look closer, we can see sclerosis around this object, which means that patient lived with it for at least several months. If we look closer, we can clearly see the signs of sclerosis, which is sign of healing of a bone. Then we can make volumetry of this tip, and we can even guess the composition. As we can see, Hounsfield units. This is density of X-ray of X-rays on CT, and we can see the value of 200 Hounsfield units, which is relatively low. So we can presume it is of a volcanic origin. Case number 4, it was fossilized bone found near Zagreb in a cave, and it was not recognizable, and paleozoologists couldn't have identified it without, as we can see here, it is difficult to say what it is and whose bone it is. But with paleoradiology, we can do several analyses, and we can remove virtually all the layers of calcium. So here we can see how it looks like without any additions. So if we go back here, we can even make 3D models which can be 3D printed with dedicated softwares, as you can see, with deposits and without deposits. And maybe the last case which I wanted to show you, it is combination of imaging and interventions, as we do in clinical radiology as well. This is urn from Histria, from Iron Age, and we can see some metal elements inside. We can mark these elements for micro excavation to maybe make a little bit easier for archaeologists to find these elements during the micro excavation, although as they said, it's not quite so simple, as it is again very narrow, the entrance. So I think someone has a microphone that is turned on.
Please switch off the microphone. Thank you.
It is, we use CT, which is X-ray based technology for orientation in horizontal level, and we use this grid for vertical alignment, and then at the crossing of two planes, we insert the needle in which we can then place the needle tip on the desired position. as you can see here, the needle tip is inserted towards the metal artifact. So we can remove virtually planes and then get the image that we want. We can see here this large metal element. Another thing, it is something similar to what we have talked about, are these biopsies. So I will show you a clinical image, how bone lesion biopsy it is done. So when we identify the place of the lesion, we take this kit, which is called Aeron Control, and we insert coaxial needle, which is a guidance. And then through this coaxial needle, which is a guidance needle, we inserted the bioptic needle, and we take 1 or 2 centimeter long sample, which is then used for analysis. We can take several samples with these needles. And I will show you how it looks like when we use it in, let's say, paleoradiological clinical settings. So this is a mummified head from Zagreb Museum from Egyptian times as well. We wanted to minimize the damage by be sure from where we have taken the biopsy sample. In this case, we wanted to do C14, although it was really maybe too small. Maybe the sample was too small for stable isotopic analysis that we wanted to do, but we got the C14 results. So we can see here meatus acousticus externus with the needle tip here, a needle tip here and here. So we have to reposition the needle and put it in front of the pyramid. Afterwards, we got this sample here. So this is how it looks like on an archaeological sample in vivo. So with this, I invite you for the next paleoradiology workshop in Zagreb. We have several hands-on sessions. Beside of that, we will combine it with some lectures. Maybe this Natasha will tell you a little bit more, maybe even some cremation workshop. And beside of that, we offer always interesting or less interesting social program. So hands-on, it is always taught as first we have micro CT session, we have CT session, we have X-ray, we have X-ray session, biopsy session, and last year we had anthropometric session with standard craniometric measures used in virtual anthropology. So with this, I would end this short overview of paleoradiology, and maybe invite you to ask me questions about paleoradiology or everything that you want. Okay, we have some question in chat. Thank you very much. Fascinating case for the fossilized bone. Was that? Sorry, I forgot to tell you what it was. It was a swine femur at the end, and software. It is Horos, which is something similar to Osiris. It is based on the same platform, but afterwards it has to be for this virtual segmentation. It has to be imported in some industrial design software for models in order to get this clean version of without any deposits. This was done by Dr. Eppenberger in Zurich, in Institute of Evolutionary Medicine. This final step of segmentation.
Maybe you could say also, MISLAV, that the workshop is also a possibility for hands-on. Not only hands-on, they can bring material as well.
Sure. It is called, so just to answer to Charlie, yes, it's called Horos. Horos, it's the same as Osiris. I can maybe share it. Just a second. Let's try to open it. Horos, let's take something like this. I'll just wait. Now I will share the Horos interface. It's practically the same as Osiris, because when Osiris professionalized itself and turned into a professional software which has to be paid, they made the same program, which is still open source, because it was based on open source program. Okay, stop share. Okay, have you seen it?
Yes. Roberto has a question.
Yes, I have a question if I can. First of all, thank you, MISLAV, for the presentation. And I have a question regarding PETA mummy, because you said that you found an artifact inside the mummy.
Yeah.
And I probably missed the point where you were saying which technique you used, because I thought it was an MRI, but I know that MRI cannot be used if there are metal pieces inside.
It was CT. It was CT, computerized tomography.
Okay. So it was a CT.
In this first case, we couldn't have used the MRI as it has metal, but we used it on this Careset mummy, which is now the mummy of an unknown man. So we used X-ray and CT.
Okay, thank you, because I was like,
maybe
how can you make an MRI on it? Maybe it was some
CT.
very weird kind of metal which is not paramagnetic.
Yeah, in case it were gold, we could have done it, because gold can go inside if it's pure gold.
Okay, thank you.
So it's a good way to see if you have a real gold ring, you know.
And can you explain about biopsy apart from C14? What can be used? Why are you making biopsy?
Well, for the moment, it can be used for, as you said, for C14. It can be used maybe for taking samples, as in clinical medicine, of taking samples of pathological process, which is maybe hidden inside the body. It can be used as marking for micro excavations, and for the moment that's it. But again, I think it's all of these three things for which we use it. It can be we can get a lot of new information, and the important thing is practically not investigated at all. It can be a nice field of new articles and the new themes.
Well, it seems that there was a lot of advance, known with the paleoradiology. And what do you think it will be the future?
Paleoradiology, I think, well, future of radiology is it's really not clear, because a lot of artificial intelligence programs are implemented, and I'm sure that in very short time, we, at least in some parts, we will be outrun by machines. Maybe for historical reasons, radiologists will remain as some sort of confirmation on, but here is where paleoradiology will remain the last standing point of humans. Okay, we have another question in chat. Very interesting with the biopsy. Sorry, I have to ask, living patients, are they sedated for a bone biopsy? Well, when I started to do it 3-4 years ago, they were deeply sedated in anesthesia, but with gaining experience, and it is enough to give local anesthetic, because bone, the only neural endings in bones are located in periosteum. So if you infiltrate periosteum well, you don't have to put patient in deep sedation, and then you have much lower risks, because it's only practically a local procedure, and it really doesn't hurt. Unless for CT spine, when we do a biopsy of the spine, then we do it in deep sedation. I don't know if this answers enough, or thanks. So I think it's a promising new field where we could. The disadvantage, of course, it's if you use this system, it is very expensive. So I reuse it in paleoradiology, as it would be too expensive. You don't have dedicated a program for spending money on a project.
Are there any more questions? Yes, there are.
Okay, we have question. Could you please explain Langerhans cell histiocytosis again? So this is the primary cancer of the bone, of specific bone cells, which are called Langerhans cells or histiocytes. In this disease, they get multiplied malignantly, and it can destroy the normal processes and anatomy of the bone. It has it has three different forms in three different clinical manifestations. One of them is this Hunchiller-Christian disease. So it is practically primary bone cancer. We have another question. Have you got any tips in identifying malignancy in skeletal collections?
This is a good one.
Any specific tips? Not, but it is you have to look to many X-rays, and then right away you can see lytic lesions, which changes the transparency of the bone. Well, this is the problem when we transfer our knowledge from clinical radiology to paleoradiology. There is no interaction with this soft tissue, so radiographer has to be aware of these different settings while scanning. And so, not particular tip, but to look all the way on the image from cortex to the middle, and to be aware of taphonomic changes as well, which can always simulate pathology.
Yeah, that's another important thing. I would say that, at least in my experience, it's important always to work with radiologists who is experienced in paleoradiology, because otherwise taphonomic changes or some like normal post-mortem cracks or whatever in the bone, like soil, can be easily confused with some pathology.
And of course, we in radiology as well, we have subspecialties. It is recommended that someone who is doing MSK, so musculoskeletal radiology, is doing paleoradiology as well. But as you know, paleoradiology, it is done outside of working time, so it's hard to find someone who will be dedicated and have time and interesting in doing it.
It's more like a weird hobby, no?
Yeah, weird hobby. And Valentina Gali said she would recommend the paleoradiology workshop, as she attended last year, but she attended, Valentina, you can correct me if I'm wrong, only online, right?
You know?
And then Charlie says that is really difficult to getting access to CT or MRI. That's true. That's maybe even more of a problem, because archaeologists and radiologists they don't cooperate too much. But when someone is inside, it is much easier. And then other archaeologists hear that there is someone who can do it, and it gets easier. So that's what Natasha said. You can bring your own material to workshop. We had some nice examples in this November. We had a dish. We had one spinal trauma, if I remember well. Natasha had some nice examples with skulls.
Bro, the full car of bones.
Roberto says it's having friends in medical setting is crucial. Yeah, that's true. No, Valentina was here, of course. I'm sorry, Valentina.
So when will be more information issued for the Zagreb workshop?
Okay, so when more information, when we see if the World War III starts. And you can bring, as we said, you can bring the. So Valentina already heard all of this that I that I lectured today.
So Charlie is asking if there will be online attendance option.
Maybe. If not, maybe online. Maybe there will be afterwards on YouTube channel. But for the moment, we don't know. For the moment, we plan to do it online. To do it
In presence, yeah. Well, the presential workshop has a good side that, like we said, you can bring your materials. So this is something we cannot really do online. So if it's possible, we will try to make it presential, of course. But if there's again some problems, then it's going to be like 1 year, 2 years ago now, it was online.
You can always,
of COVID.
you can always write me email if you have question, or if you would like to scan the material or something. Okay, so if this is all, I will salute you. Thank you for letting me in.
It's a great pleasure, MISLAV, to have you here. And thanks to everyone that was present here. And I hope that it was useful for you. And of course, if you're interested to learn more about like advanced in bioarchaeology, you can still apply and to the continuation of this course. And of course, if you're watching this like later, we're going to post it on YouTube. You can always write to MISLAV if you have, or to me, of course, if you have some additional questions about this. So thank you so much, and I hope I'll see you soon. Thank you so much, Elena, Rachel, everybody. I'm glad that you, Natasha, Aurora, and thank you. I'm glad that you like it.
Thank you, Natasha.
Thank you so much.
Good evening. Bye-bye.
Bye-bye. Have a nice evening.
Bye. See you.